We don't have a healthcare system, we have a sickness management system. We wait until people break, then prescribe lifelong treatments instead of restoring health. Meanwhile, we eat constantly, ignoring the biology that shaped us. Humans weren't designed for 3 meals a day, and the consequences are quietly medicated, not cured. Before I continue, please give this video a thumbs up and share it with your friends, so more people can discover this content. Also subscribe to receive more content like this. Modern society prides itself on advanced healthcare, yet the system we rely on is fundamentally reactive rather than restorative. We wait until people are sick, and once sickness appears, we rarely focus on restoring true health. Instead, we manage conditions, often for life, through medication and ongoing treatment. This approach may control symptoms, but it seldom addresses the root causes of illness. As a result, chronic disease has become normalized, not cured. A major contributor to this problem is lifestyle, particularly diet. Humans evolved over hundreds of thousands of years in environments where food was scarce and unpredictable. Our bodies adapted to periods of eating followed by periods of fasting. We were not designed to eat constantly, yet modern culture encourages 3 meals a day plus snacks, often rich in refined carbohydrates and processed ingredients. This pattern keeps insulin levels elevated, stresses the digestive system, and prevents the body from entering its natural cellular repair and recycling mode that clears out cellular waste and supports long-term cellular health, which is essential for cellular health. Rather than questioning whether this constant feeding aligns with human biology, the healthcare system largely treats the consequences. Obesity, type 2 diabetes, cardiovascular disease, and metabolic syndrome are managed with prescriptions rather than prevented through meaningful dietary reform. Patients are told their condition is lifelong, reinforcing dependency on treatment instead of empowering recovery. The focus becomes disease management, not health restoration. This is not to dismiss the value of modern medicine. Acute care, emergency interventions, and surgical advances save countless lives. However, chronic illnesses, many of which are diet and lifestyle-driven, require a different approach. True healthcare should prioritize prevention, education, and biological alignment. Teaching people when not to eat may be just as important as teaching them what to eat. Emerging research on intermittent fasting and reduced meal frequency, less frequent eating can improve insulin sensitivity, reduce inflammation, and support metabolic health. Yet these ideas remain on the fringes of mainstream medical advice, partly because they challenge entrenched systems built around treatment rather than prevention. The uncomfortable truth is that a population dependent on lifelong management is more profitable than a population restored to health. When illness becomes routine, so does medication. When symptoms are controlled instead of eliminated, patients remain permanent customers rather than recovered individuals. If we genuinely want better health outcomes, we must rethink both our healthcare model and our eating habits. Instead of waiting for sickness and managing decline, we should aim to restore health by addressing root causes, starting with how often we eat, what we consume, and how closely our lifestyles align with human biology. Health should not be something we manage when it fails, but something we actively preserve before it breaks. If this made you question what you've been told about health, don't keep it to yourself. Like this, share it with someone who needs to hear it, and subscribe for more honest conversations. Most importantly, comment below, challenge the idea, add your experience, or start the discussion. Real change begins with dialogue.